Hello, and welcome to Lab 3. Lab 3 is all about the heart. So we're going to look at the outside of the heart, the inside of the heart, and all the blood vessels that are actually on the heart. So if we start by looking at, here's our model of the heart. Our heart is kind of divided into 4 different chambers. We have this right atrium, which is an upper chamber. We have a left atrium. We have a right ventricle, and we have a left ventricle. Our atrium also has an area within it that's kind of collapsed down, but it can expand out if there's extra blood that is filling within our heart. That area found within those atrium are our auricles. So we have our right auricle and our left auricle. If you kind of notice these auricles, you can especially see it on the left side, how it kind of is bunched up here. This is collapsed down tissue that can expand out if there's more blood coming into that atrium quicker. Something that's a little bit different about the heart, when most people think of the apex of the heart, they're thinking of the top. The apex of the heart specifically is at the bottom. This is something that is different than other organs. That apex, this is an area we actually listen to using a stethoscope when we're listening to different areas of the heart. This is one of the places that we actually listen to, is at the apex, because you can hear different sounds in different areas. And this is one of those areas that we pay special attention to. Another thing that we can see on the front of the heart here, we have this anterior interventricular sulcus. This is just kind of that area. Interventricular, inter means that between, ventricular, inter between the ventricles. This is just kind of a little divot that comes down between the 2 ventricles that kind of helps separate out that right and left side. Here we also see the ligamentum arteriosum. This ligament, this is a little ligament found in here. During prenatal life, this used to be a little blood vessel, because during prenatal life, during that fetal development, the heart just works to move the blood around the body. Mixing of that oxygenated and deoxygenated or low oxygenated blood does not need to occur in fetal life like it does in once you're outside of that womb. So this used to be a little blood vessel here in this ligamentum arteriosum. After birth, it turns into this little ligament that kind of helps hold this aorta and this pulmonary trunk together, keeping things in place where they're supposed to go. So let's look at some of the different blood vessels coming off of that are on the heart or coming right off the heart. So the blood vessels that are actually on the heart are usually some sort of coronary vessel. Coronary means heart. So blood vessels that are directly on that heart are coronary. So on the right side, we're going to have this right coronary artery that's coming right off. It comes right off of this aorta, this very large blood vessel here. We have our ascending aorta, arch of the aorta, and then technically it descends down. So then we have our descending aorta before we go to the thoracic aorta. We'll get to that in lab 4. But coming off of this aorta, we have our right coronary artery that's going down through the right side of the heart. And then we have our left coronary artery that goes on the left side. Remember, when you're looking at something, your left is that person's right side. Your right side is that person's left side. So everything is always flipped. This is something that I notice that students miss. So I try to point it out so you become aware of it. So that flipping, making sure, because these 2 vessels are the 2 main vessels that are giving off the different blood vessels that are going to feed the heart. It's that right coronary artery and that left coronary artery. Now, if we look coming off of this left coronary artery, one of the first branches is going to be the anterior interventricular artery. Anterior, it's on the front of the heart, interventricular, between those two ventricles, and it's carrying oxygenated blood, so it's red. We also have the great cardiac vein. That great cardiac vein kind of follows that anterior interventricular artery. We also have a branch of a circumflex artery that's coming off of that left coronary artery. These are those different arteries, again, that are helping to feed the heart. I should point out, red, most people think red means arteries, blue means veins. That's not always true, especially when we're talking the heart. Red means blood that is rich in oxygen, has a lot of oxygen on it. Blue means there's very little oxygen, that's low in oxygen. Why do I say this? Because we have our pulmonary trunk here. This pulmonary trunk, this blood vessel, it's blood that is leaving the heart, but those arteries, it's leaving the heart, so it's an artery, but it's low in oxygen, which is what makes that blood vessel blue. So if we look, we've got pulmonary arteries. Those pulmonary arteries are these blue ones. This pulmonary trunk is going to split into this left and right pulmonary artery. From here, those blood vessels are going to go to the lungs. They're going to pick up oxygen. Then they're going to come back to the heart. This is where we get our pulmonary veins. You can see it on the left side. When I have pictures of the back of the heart, so we can see it there too. But these pulmonary veins, if you notice, they're red because they're full of oxygen. That's where that red and that blue red doesn't always mean artery, blue doesn't always mean vein. It just means full of oxygen and low in oxygen. Here we can also see, if we look back, we have the superior vena cava. The superior vena cava is one of those blood vessels that is bringing blood back to the heart. That superior vena cava is bringing blood from the head, the neck, and usually the arms. Both arms those vessels feed into that superior vena cava. Just looking. Okay. So the superior vena cava is made from this left brachiocephalic vein and this right brachiocephalic vein. Two different veins coming together to make that superior vena cava. We also have this brachiocephalic trunk. This is now an artery that is branching off of that ascending aorta. It goes to that arch. Now this is blood that is heading off towards that head and neck. We have that left common carotid artery, and then we have our left subclavian artery. These are arteries, the three main arteries that are branching off of that arch of that aorta to go to many different places around the body. So now we can see the back of the heart. Here we have that right atrium. If we're looking at it from a posterior view, from behind, now your right side and their right side match, your left side and their left side match. I know it's very confusing, but this is, you got to think about it sometimes in that view. When I work with patients, sometimes I have to put myself, okay, what position were that patient just laying in? Okay, that's my right side. That's okay. When I'm figuring out right versus left, sometimes if I'm not in the room with the patient, I'll sit and actually turn myself to face whichever way the patient is facing to figure out right versus left. I don't know, but it helps. And I know I'm not the only one because nurses I've worked with do the exact same thing. So we have that right atrium, that left atrium. We can kind of see them better. We see that right ventricle, that left ventricle. Here we can see that coronary sinus. This coronary sinus, a sinus is an area where blood kind of pools and collects before it drains somewhere else. In Anatomy 1, there were some different sinuses that were in the skull where blood kind of drained and collected in different areas. Here we have one on the heart, that coronary sinus. So all of our blood vessels, all of our veins that are going back to the heart that have given the heart oxygen that it's needed is now draining into that coronary sinus where it's going to drain into this right atrium. We can also see that apex of the heart, that base of the heart from this view as well. Here we're going to get into some of these blood vessels. So here I mentioned you can see those pulmonary veins. Those pulmonary veins are those red ones. Red because they're full of oxygen. We can also see this inferior vena cava. This inferior vena cava, this is draining blood pretty much from the chest all the way down. Or actually, it's taking blood from your legs, your trunk, your like pelvic cavity, abdominal cavity, and most of your chest cavity up towards the heart and taking it back to the heart so they can go pick up new fresh oxygen. But here you can kind of see this great cardiac vein following around before it becomes that coronary sinus. We have the posterior interventricular artery. I'm looking to see exactly which ones you need. Marginal artery. And then here's that right coronary artery as it's coming around. We also see that superior vena cava right here. You've got that right pulmonary artery. That's blue. Pulmonary means it's going, pulmonary is for lungs, so it's going to the lungs to pick up oxygen. You also see that aortic arch. You also have that left pulmonary artery. You have that left subclavian, left common carotid, and right brachiocephalic trunk. Now, if we open the heart, there's a lot of things to see when we open the heart. Some of the first ones, let me come back up here for a second. The outermost layer of the heart is known as, the heart kind of sits within a sac that's known as the pericardium. The layer that sits directly on top of the heart is that visceral pericardium. So this kind of, the whole outside is kind of this visceral pericardium that this heart is surrounded in. The middle layer, this muscular layer right here, that is that myo means muscle, cardium for heart. So that's that myocardium. And then that very inner layer of the heart is that endocardium. We have a lot of different things that are going on in this heart. We have this fossa ovalis or fossa ovale. What this is during fetal development, that's a hole between the right and the left atrium of the heart. Because again, that fetus is not getting its oxygenated blood from the lungs, it's getting it from the placenta. So the heart kind of functions just to help move that blood around the body, while that oxygenated blood is getting picked up somewhere else. So it doesn't matter that that right and the left side of that blood is mixing at this point. It only matters after birth. In our atrium, we have what are known as pectinate muscles. These little pectinate muscles kind of help these atrium contract to push blood into our ventricles. So when blood is coming into the heart, it's coming through this superior vena cava, it's coming up from that inferior vena cava, and it's also going to come from that coronary sinus where it is draining blood specifically into that right atrium. So when that right atrium goes to contract, those pectinate muscles are the ones that are actually causing that heart to contract and push that blood into that right ventricle. In this ventricle, you can't see it from this view. I've got some other views where we can see it. We've got valves that separate the atrium from the ventricles. So through these valves are kind of held in place by these little cords that are known as these chordae tendineae. These chordae tendineae are held in place by papillary muscles. So there's these little muscles that these cords attach to that help these valves kind of stay where they're supposed to. Here you can kind of see this pulmonary semilunar valve. This pulmonary valve, this right ventricle is going to contract and push blood through that pulmonary valve and up. This is what sends that blood off to the lungs to pick up oxygen. We can also see that interventricular septum, between ventricles, that septum, this wall that separates the whole right and the left ventricle. You can also see, you can kind of see this mitral valve. This mitral valve is also known as that bicuspid valve, because it has two cusps to it. I still hear mitral valve used most often. I don't hear bicuspid valve heard very often, especially when you're listening to different areas of the heart. It's still mostly referred to as that mitral valve. So that's the better name to learn, honestly. Here, we're getting to the different vessels again. So you can see that ascending aorta, you can see that arch of the aorta, you see that pulmonary trunk, that left pulmonary artery, you've got that brachiocephalic trunk, left common carotid, left subclavian, superior vena cava. You see that right coronary artery really well. So here's a really good view to see these valves. That tricuspid valve, yes, this is mostly known as that tricuspid valve. That's the main name for it. Tricuspid because it has three cusps to it. It has three parts that come together. And then you can see these papillary muscles coming up. You can see this pulmonary semilunar valve, that interventricular septum. Here you see the aortic semilunar valve. So this is pushing blood up into that aorta. You see that mitral valve, those chordae tendineae, those little cords that are coming down to kind of help that valve stay in place. Here you also see that apex, that left ventricle and that right ventricle. The wall of that left ventricle, this isn't the best model to show it, but the wall of that left ventricle is usually a lot thicker than the right side. Why? Because that left ventricle is pushing blood out to your entire body. It's got to push blood all the way down to your toes. That right ventricle is only pumping blood to the lungs, which is right next door. So that right ventricle should not be working very hard to pump that blood to the rest, or to those lungs, like that left ventricle. That left ventricle wall is usually thicker because it's pumping blood further places. So now if we look at cardiac muscle real quick, here in the cardiac muscle, we looked at this in Anatomy 1. We're seeing it again. We have these intercalated discs. Those intercalated discs are these dark little lines found within our muscles here. So that's what makes cardiac muscle different, is these cardiac muscle cells are a lot smaller because skeletal muscle fibers are very long. Cardiac muscles are smaller, but they have those intercalated discs. These are like those little gap junctions that are helping to hold these muscle cells together. Here's the nice, cool cadaver picture of the heart. You can kind of see all of the different structures. Here we can see it from the inside. The thing that I like about this specifically is you can see those chordae tendineae. You can see all of these little cords here helping to hold that valve in place. The model didn't show it really well, but this shows it really well. So let's go through how blood travels through the heart. Blood is coming into the heart through that superior vena cava, that inferior vena cava, or that coronary sinus. It is coming to that right atrium. That right atrium is going to contract and push blood to that right ventricle. From here, it's going to contract and push blood up through that pulmonary valve, through that pulmonary trunk, and off to the lungs. The lungs are going to get that blood oxygen. It's going to bring that blood back through pulmonary veins to that left side of the heart, that left atrium. It's going to go through that mitral valve to that left ventricle. Then it'll go through that that aortic valve up, and then it travels out to the rest of the body. That's kind of the way the blood travels through the heart, making sure you know the left side is the low oxygenated or low deoxygenated blood. That right side is that area that is full of oxygen. I like this picture because they colored the different vessels so you can see what they look like front and back. Here is just some of the drawings from your textbook. This is a really nice picture because it shows the different areas that we listen to and what we can hear. The spaces between the ribs are called those intercostal spaces. So on the right side of the sternum, in that second intercostal space is where we listen for that aortic valve. On the left side of the sternum, in that second intercostal space is where we listen specifically for that pulmonic valve. Now, if we come all the way down, where the last set of cartilage comes and attaches to that sternum is where we get that tricuspid, and then that mitral, as I mentioned, is in that apex. So it's usually that fifth intercostal space. It's usually pretty close to midclavicular. Middle of that clavicle, follow it down. So this is just a really nice picture that shows that. There's something here that none of these images really show, so I want to go through it. It's the heart's conduction system. This is very important, especially those who want to go into medicine, nursing, knowing the heart's conduction system, because when there's a problem with that conduction system, it can cause all kinds of issues. So, and your lab handout, it's not listed in order, so I'm going to go through it. This is the best picture I can use with it. At the top of this left atrium, we have that sinoatrial node, or that SA node. This is what starts the heart contractions. It'll start here, and then it's going to travel down to this area below the bottom of that left atrium. This is also traveling over to that right side. But this here is that AV, or atrioventricular node. That atrioventricular node is then going to send out information down through these ventricles. So we have this AV bundle that starts, then it's going to turn into two branches. That goes our AV, or our bundle branches, which are then going to branch out to the right side of the heart and that left side of the heart. I hear them more still as Purkinje fibers than conduction myofibers, but that's what allows that ventricle to contract. Are these conduction myofibers or these Purkinje fibers? These are important to know because something is blocked somewhere, like that sinoatrial node is not working, that SA node, or that AV. I hear a lot of AV bundle blocks, meaning nothing's going out to those ventricles to tell it to contract. A heart block, first degree, second degree heart block, information's not getting sent out to the heart in various areas. So some of this stuff is knowing it is going to be very helpful, because once you start learning the problems that can occur with it, I go through some of those in the lecture, but once you get through some of those, it can be it can cause a lot of different problems throughout the heart. Thank you very much for listening, and have a wonderful day.